Yes, there are some drugs that have an interaction with the contraceptive pill, namely a drug called Bosantan, or otherwise known by its trade name as Triclea. It can reduce the effectiveness of the pill and therefore make you more likely to become pregnant if you are taking that medication. And there are special instructions that go along with taking such medication, where you do use 2 forms of contraception, or it may be that you have to do an increased dose of the contraceptive pill that you're taking.
My advice, generally speaking, without giving a list of different things, is that it's really helpful. I know when I see people in clinic and things like that and have conversations with other health professionals, that as a person with a said condition, and again it's about being pre-armed, and that is always make sure you've got an up-to-date list of drugs that you're on. Not just your pH drugs, but all your drugs. So if you're seeing somebody's giving you some advice about family planning, or an obstetrician, or even whatever, that you've got an up-to-date list. I've seen many times people sort of try to think, I have a blue one and a pink one, I think I take it that time. Having that list is really useful. So then that advice can be, and if in doubt, always ask that. And probably the best people to ask are people like pharmacists and chemists, rather than nurses and doctors who are experienced, but that's their sort of real area of experience, and they'll be able to get that answer. But always ask the question.
So again, it's an informed choice that the patient has to make with regards to taking contraception and knowing there's an interaction with their medication. And it's important that we do tell them about that, especially when they, for example, are taking antibiotics, which can also interact with the contraceptive pill. And there may well be a need to use additional forms of contraception.
The contraception that is going to interact with any medication, like we said earlier, is the ones with the hormones in. So all the different types that rely on a hormone stopping you from ovulating. Generally, if somebody is prescribing a medication for you, they should always ask what medication you're on, and if they're going to prescribe something that does interact with the contraception, they certainly should be asking about your contraception. But it's always worth reminding them, just in case they don't, or just to be absolutely sure, just remind them what medication you're on, including what type of contraception that you're on. The really common ones that we come across more are certain antibiotics. So generally, if a doctor's giving you, or a nurse is giving you antibiotics, just double check and say, do I need to do anything extra with my contraception? So people sometimes forget about the herbal remedies. They think that they've got no interaction with sort of Western medicine, or whatever you like to describe it. But actually the herbal medication can sometimes interact. So wherever you're getting your herbal medication from, just double check with them as well. It won't interact with your medication.